Diabetes, resistant to insulin. Type 2 diabetes is affecting more and more people at a younger age as time passes by. According to the article by Endocrinology Advisor by Cheezer, the youngest person to whoever has been diagnosed with type 2 diabetes would be a 3-year-old girl. Even though both parents were overweight, the girl had no family history in diabetes. The child's diet has went under review and has revealed that the diet had poor family nutritional values and contained lots of calories and fat. Type 2 diabetes is an impairment of the way the body regulates and uses sugar, such as glucose, as a fuel. This long-term chronic condition results in too much sugar circulating in the bloodstream. Eventually, high blood sugars can lead to disorders in the circulatory, nervous, and immune system. According to the Center for Disease Control and Prevention, in August 2021, more than 34 million Americans have diabetes, which that would be about 1 to 10 Americans. And approximately 90 to 95% of them has type 2 diabetes. Type 2 diabetes most often develops in people over the age of 45, but nowadays more and more children, teens, and young adults are also developing it. We will learn exactly what diabetes is, how common it can be nowadays, how to manage it, and how to prevent getting diabetes. Diabetes is a disease that's becoming more and more common nowadays. So let's first look at some basic facts. The vast majority of people who have diabetes have type 2 diabetes. According to the article by Life Science, currently 1 out of 10 Americans have type 2 diabetes. But if the cases continue as projected, its prevalence could double or even triple in the next 40 years. The cases of type 2 diabetes have doubled in America in the past 20 years. Diabetes is the leading cause of death in the world. It is currently the number 7 cause of the death in the United States and has a much more higher mortality rate than the rest of the world. If the current trend of diabetes continues to rise, by 2050, 1 out of 3 people will have type 2 diabetes. Type 2 diabetes is the most common form of diabetes. It is triggered by a combination of unchangeable factors such as family history and race, and uncontrollable factors such as obesity and inactivity, according to the article by Mayo Clinic. It can also be a leading cause of leg and foot amputations, kidney failures, and new cases of blindness for patients under the age of 75. According to the article by WebMD, written by M. Danziger, with an aging population and the growth of minority populations are expected to add the disease prevalence. African Americans, Latinos, Native Americans, and certain Asians and Pacific Islanders are at a high risk of developing diabetes. Now that we understand what diabetes is and how common it can be, we need to know how doctors can diagnose and treat this illness. Fortunately for modern medicine, there are many ways of dealing with diseases like diabetes. So, like as I mentioned, doctors have developed many different methods of dealing diabetes. Because diabetes can last for a very long time, here's the ways how they can be managed. Moderate regular exercise and weight loss control can go a long way to help minimize the symptoms of diabetes and the complications that can result from it. If diabetes can be discovered early on, you have a much better chance of being able to keeping it under control. Metformin is a tried and tested medicine that can be used for many decades to treat type 2 diabetes. According to an article from Harvard Health Publishing by S. Hafida, metformin is recommended by most experts as first-line therapy. It is affordable, safe, and effective, and well tolerated by most people. When metformin does not adequately control blood sugar, other medication must be added. It is at this point that doctors and patients must choose among the many other drugs and drug classes available to treat type 2 diabetes. In general, for people who are at low risk of heart disease, have no history of diabetic kidney disease, most diabetes medications are added to metformin effectively reduce blood sugars. Lately, newer treatment options for type 2 diabetes like glucagon-like peptide receptor agonists and sodium glucose cotransporter inhibitors have been heavily advertised. The newer drug classes lower the blood sugar and also have cardiovascular and kidney benefits. So while medical professionals have ways of treating diabetes, a bit of care can really go a long way. Fortunately, there are many ways the diabetes can be prevented. So let's look at some of the best ways to avoid it. The best methods of preventing diabetes will be being physically active and eating a healthy, well-balanced meal plan. One of the basic methods of preventing that can be most effective will be eating right and following a healthy meal plan, like as I just mentioned. It is important to reduce the amounts of calories that you eat and drink in each day, so you can lose weight and keep it off. To do that, your diet should include smaller portions and less fat and sugar. You should also eat a variety of foods that come from each food group, including plenty of whole grains, fruits, and vegetables. It is a good idea to limit red meat and avoid processed meats. Another great method of preventing diabetes, it can be very effective, would be to exercise often and to be staying physically active. According to an article by Medline Plus, losing weight and keeping it off, weight control is an important part of diabetes prevention. You may be able to prevent or delay diabetes by losing 5 to 10% of your current weight. For example, if you weigh around 200 pounds, your goal would be to lose around 10 to 20 pounds. Once you lose the weight, it is important that you do not gain it back. Also another way to preventing it, same way, is to get regular exercise. Exercise has many health benefits, including helping you lose weight and to lower your blood sugar levels. These both can lower your risk of type 2 diabetes, so try to get around 30 minutes of physical activity 5 times a week. If you're not able to be active, talk to a healthcare professional to figure out the types of exercise that are best for you. You can slowly start and work up towards your goal. So having to learn about what diabetes is and how common it is, next we have learned about how to treat it, and finally what we can do to prevent ourselves from getting it. Hopefully we can continue or start to continue living a healthy life, and so like that we can last for a very, very long time. While type 2 diabetes is a real risk, especially for anybody with an impaired immune system, it is important to remember that the benefits of modern medicine can still far outweigh the risk, but is more importantly the way how we take care of ourselves can be way much more beneficial. Still, it is a good idea to be on the lookout for potential health problems.